had the CBT, cognitive behavior therapy for insomnia, and cognitive behavioral therapy intervention for depression. And then we had some interventions that were in person. There was a relaxation training, there was a structured exercise. I seem to have disappeared from the slide. A structured exercise and also a goal management training. Next slide. So this was our model. So the participants had 4 visits. They were recruited at 5 sites across Canada: Vancouver, Toronto, Hamilton, and Montreal. And they had 4 visits that were 9 months apart. And we wanted to use a very comprehensive model to understand how a biological condition such as HIV and its treatment impacts quality of life. So the model that we used looks at characteristics of the individual, also characteristics of the environment. So are people feeling safe in their environment? Do they benefit from social support? We were documenting biological variables, HIV related, but also comorbidity, medication, documenting the presence of several symptoms such as fatigue, pain, anxiety, depression, cognitive difficulties. Um, we also had a measure of cognitive functioning that we developed specifically for this project. And the project was different from the usual our approach when people look at cognition in HIV, in that we didn't ask, is cognition better or worse in HIV than in other populations? Because other groups have done that. But our question was, if people do have cognitive difficulty, does it impact how they function? Does it impact how they perceive their health and how they rate their quality of life? Always taking into considerations the presence of other symptoms. So for example, if you have cognitive difficulties, does it affect your quality of life if you do not have depression and anxiety? So we used quite a complex statistical model that would account for the complexity of the issue. Now, I want to address the issue of measurement of quality of life, because I know, Jason, this is something that you had mentioned, and quite a few people have really alluded to this, what is quality of life? We used 2 measures of quality of life. One was developed by the WHO after consultations very broadly across the globe. And it's called the WQOL. It's a health-related quality of life. And it asks several questions about, are you satisfied with your access to information, access to leisure activity? It's asking about symptoms, about financial difficulties. And when you answer all these questions, you have a score on quality of life. We also used a different instrument, which is a personalized instrument. So rather than asking, giving people a list of items and asking, do you have this and this and that? People are asked during the in-person assessment, tell me about areas of your life that have been impacted by HIV. How important is this issue? And if you were given 10 tokens, how many tokens would you be willing to spend to improve each one of these issues? So it gives a personalized assessment of quality of life. And what we found is that there's a big difference between both approaches. And maybe one item that I can use to illustrate that is when you look at the WQOL, which has been very useful because it gives you a measure on several aspects of a person's life that you may not otherwise, ask in individual questionnaire. Let's say someone is experiencing a lot of stigma. In the WQOL, stigma is one item. What we found in the individual interview is that several people were bringing up stigma as the area that was most affected by HIV. This was an area that was very important to them, and they would be willing to invest several tokens in fixing it. So if stigma is your only problem, on the woke wall, you're going to come across as having excellent quality of life, but the individual assessment is going to reveal just how much this one item has an impact for you. So I'm not sure how wellness is going to be assessed, because it seems to be more than quality of life. But I guess my recommendation was, I'm not sure how it's going to measure it, but there probably should be an individualized component to it, that people maybe should define what wellness is for them. Next slide. So what we did after, collecting a lot of data on a lot of participants is we used this statistical model that helps us give a quantity to how much each symptom or each combination of symptom will impact quality of life, and what is the path. I give you an example. We found that depression has a huge impact on quality of life. Depression also is associated with a decrease in the amount of meaningful activities that people can do, and decreasing the amount of meaningful activity also has an additional impact on quality of life. So putting all of this together, we've been able to develop a model, I guess a predictive model of quality of life that is almost 90% accurate. And we're able to attach a number to each symptom or difficulty that could help prioritize what would be the biggest ticket item, in a way, if you want to fix either quality of life, or the second aspect we were looking at is the presence of cognitive difficulty, because this was a study on brain health. Next slide. So after we've collected all of this, what do we plan to do with this? Well, we're very keen to bring it back to either the clinic setting or to people who are living with HIV. And I think it's very fitting that the community has played a predominant role in putting together this excellent series of afternoons for Montreal, because when we're talking about well-being, I agree that it's important that physicians have on their radar that quality of life or wellness is what's most important to people living with HIV. At the same time, I don't think that physicians are ever going to be experts on wellness. Just because, as a psychiatrist, I have a hard time keeping track on all the new developments in psychiatry. So I think, physicians have a, quite busy time keeping track with what's happening with, taking care of the medical condition. And so they're not, I don't think they're ever going to be expert on wellness. So a lot of it is going to have to be in collaboration with the community or with people living with HIV. So we wanted to make sure that we developed the tools that had the information we collected in the first phase in a way that can be used by a person living with HIV and their physician. So there's two aspects to the second phase of the study that we're starting now. One is that we're going to continue monitoring what happens with brain health over time with a longer time follow-up. And then the two other aspects is the one I'm going to present, and the second one is what Adria is going to present. So what we want is we're developing an app that would start when in evaluation of several symptoms that we found to be important, pain, fatigue, anxiety, depression, and so on. Ask about the presence of cognitive difficulty. And we could even ask about some biological parameters. Next slide. And then we would give people feedback, based on the answers that you've given us. This is your brain health profile. So this is an example. You're thinking and memory, you're reporting some difficulty, your mood seems to be down, your motivation is good, and your overall brain health and how you're feeling about your health and how you rate your quality of life seems to be, there's a yellow there, yellow light. So that's the feedback. Next slide. In the third phase, we would ask people to select a goal. What would you like to work on? Do you want to improve your cognition or you want to focus on your quality of life? The suggestions as to what people could be working on may be the same, but they may not have the same priority. I can tell you for now, if you want to focus on quality of life and your mood is giving you difficulty, we're going to tell you that mood is the most important issue to focus on. So after people select a goal, next slide, the app would provide you with tailored recommendation as to 2 or 3 items that you may want to focus on to reach your goal. And then we would connect you with resources that can be used either for self-care or to empower people. And also there would be a printout that could be brought to the physician to highlight for the physicians the priorities that you would like to work on. So this is what we're one of the aims of the second phase of the study. And now I'm going to turn it over to Adria.
All right. So I just wanted to acknowledge that I'm currently living on the traditional territory of the Mi'kmaq, and we are all treaty people. I'm just going to talk very briefly about a pilot study that I'm working on as part of the Brain Health Now study. And just a little bit of a background. So the evidence is indicating that many older people living with HIV could protect or improve their brain health through lifestyle change. But lifestyle change is difficult for everyone, but maybe even more challenging for people who have a chronic condition that affects cognitive ability. So really the important question here is whether interventions will help brain health in HIV, the important question isn't whether interventions will help improve brain health in HIV, but how we can improve adherence to the most promising interventions. So goal management training is a cognitive rehabilitation program that targets executive dysfunction. And it helps to teach self-management and mindfulness techniques to participants. And it also trains participants to use explicit strategies to reduce cognitive load during everyday tasks. The Healthy Lifestyle Program is an online exercise program where we will be weaning participants to independent exercise in the community. So we provide continuous monitoring and feedback of physical activity and social activities, goal setting, as well as mood and access to community resources. So essentially, we want to know if goal management training before a healthy lifestyle program improves adherence to health recommendations, achievement of health goals, brain health, and health outcomes compared to those who participate in the healthy lifestyle program alone. So here's a quick flow chart of how the study will roll out. We will identify participants from the Brain Health Now cohort who have indicators of cognitive frailty or they're not aging successfully. All the participants will be asked to attend an online workshop where they will learn how to set goals, how to use an activity tracker that we will provide them, and how to use 2 apps, the My Health app and the Goal Setting app. The My Health app has already been developed and been used with our collaborators and will allow us to track our participants' health-related quality of life using weekly visual analog scale questions. We're also developing a goal-setting app, which will help participants set goals and monitor their progress over the course of the study. Participants will be randomized to goal management training, or they'll enter the Healthy Lifestyle Program directly, and they will participate for a total of 52 weeks. So as a result of the COVID-19 pandemic, this study, like many studies, is shifting to an online format. So we are developing currently a goal-setting app where participants will be asked to set 3 goals. So on the first little box there, if the person selects better sleep, for example, then they can select corresponding actions to be able to achieve that goal. And then we ask participants to rate how difficult it would be to achieve the goal and how important the goal is. And then we monitor their goals throughout the course of the study. As part of the Healthy Lifestyle program, we have developed a healthy lifestyle manual that's available in French and in English. And we've put together or created resources on smoking cessation, brain health, social engagement, mental health, sleep, fatigue, nutrition, and alcohol and drugs. And as part of my role in this, I'm creating the manual, but I've also put together some boot camp classes for our participants so that they can engage in physical activity online. In terms of our outcomes, we are interested in adherence, so the number of weeks where participants met their exercise and social interaction targets. And then our downstream outcomes include health-related quality of life, cognitive ability, and vascular risk profile. And that's it. Thank you, everyone.
Thank you very much, Marie-Josée and Adria. Those were amazing presentations. You've given us so much food for thought. And as Val commented in the chat, these are healthy, positive actions that we can put into practice. I love it. It's awesome, and the amount of chat that was generated during these presentations this afternoon, I think is a testament to that.